another source of self-congratulation in Australia by comparison with the United States, in addition to the health of our banking system, is the health of our health system. Every time I go into Medicare with a doctor's bill and they give me money in return, or better still go to a bulk billing doctor and walk out without paying a cent, I think about all those poor buggers in America and the expensive mess that they have to put up with. But the problem here is that demand exceeds supply, and demand is growing so rapidly as we all live longer that there's no hope of the supply catching up. Earlier this year, the government announced a big new health reform package designed to deal with this problem, including some more money and case mix funding, in which money is paid for actual procedures, not just handed over to hospitals. Now, apart from the fact that WA hasn't signed up, the health box was ticked, and the Labor policy caravan rattled onto something else. But the Victorian system, which has had case mix funding for 15 years, still has chronic demand-supply imbalance. And there simply isn't enough money in Australia to close the gap without further reform. So money has to be paid for outcomes, not just for doing operations. Doctors and clinicians will hate this, just as teachers hate being paid for performance. But it's the only way to seriously address the looming health crisis, in my view. Health Minister Nicola Roxon's proposed My Hospital's website, with which patients will be able to compare the performance of hospitals, will be a good start. But the next step should be government funding should reward the best hospitals, the ones that get people better fastest and most efficiently.